In a world of beauty and abundance, there are some who suffer beyond our imagination. We can, together, make a significant difference in their situation. We can bring hope by changing lives, one person at a time. Sub-Saharan Africa is one of the poorest regions in the world and has the fastest growing population, half of whom are living below the poverty line. The Millennium Development Goals report that by 2015, the poorest countries in Africa are likely to have a rising proportion of those living in extreme poverty, lacking primary school education and dying before the age of 5. More shocking is that families with children living in sub-Saharan Africa represent over 10% of the world's population, but is home to more than 60% of the 42 million people living with HIV/AIDS. Another catastrophic killer that challenges sub-Saharan Africa is malaria. Malaria kills approximately 2 children every minute. 91 more victims die every hour. Globally, an estimated 800,000 deaths will occur this year. Most of those will be children and pregnant mothers. Malaria accounts for about 40% of sub-Saharan Africa's health expenditures and costs an estimated $12 billion in lost productivity annually. Increasing diseases of the eye and blindness constitute a major health concern in sub-Saharan Africa. Globally, 80% of blindness-causing diseases are preventable, and sub-Saharan Africa is one of the most affected areas. The World Health Organization estimates that by 2020, there will be 20 million new cancer cases per year worldwide. About 70% of these cases will occur in the developing world, where only 10% of the global resources will be available. Ghana is recognized as one of the more developed countries in this region. Ghana is located in Western Africa on the Gulf of Guinea and has a population of more than 23 million people. It is precisely here in Ghana that the international humanitarian organization Hope Exchange has constructed the Hope Exchange Medical Center, serving as the base for coordination and execution of the Sub-Saharan Health Project. The Hope Exchange Medical Center is a collaborative international effort to increase the strategic healthcare capacity in Sub-Saharan Africa through the development of a comprehensive, innovative, scalable and replicable model of intervention. Hope Exchange's culturally sensitive approach has resulted in the enthusiastic endorsement by all political, civil and religious leaders of the area, as well as the medical and scientific community of the region. The President of Ghana, John Evans Atta Mills, as well as the former President, John Kufuor, have extended their full support to this unique regional health project. Both presidents have committed the very office of the President to assist this regional health project in any way possible. On a visit to the Hope Exchange Medical Center, the American ambassador to Ghana, Mr. Donald Tettelbaum, commented that the Hope Exchange Medical Center is a shining example of when
actions speak louder than words. I think this building is an action that speaks to the values of everybody here.
The Hope Exchange Medical Center is a newly built 80-bed medical facility located in Kumasi, Ghana, a city of more than 1.5 million people in the heart of sub-Saharan Africa. The center will provide high-quality subspecialty medical training and patient care in various fields of medicine, with a particular emphasis on malaria, HIV/AIDS, female cancers, craniofacial malformations, and ophthalmology. The project includes a major initiative designed to engage physicians in clinical and translational research. The Hope Exchange Health Project is a unique effort in combating malaria, particularly severe cases found in children and pregnant women. This initiative will bring together cutting-edge research based on clinical diagnosis and synchronized with in-house clinical activities at the Hope Exchange Medical Center. Dr. Sri Agbenyaga is one of the foremost malaria experts in Africa. He is a professor at the Department of Physiology at the Kwame Nkrumah University of Science and Technology and also the Principal Medical Officer at the Department of Child Health in Ghana. Commenting about the Hope Exchange Health Project, he emphasized that most African countries are under constant threat from counterfeit and substandard medicines and other health products. The Hope Exchange Medical Center will also house a drug quality control laboratory that will serve the sub-Saharan region. It will also facilitate the uniting of African countries to fight counterfeit medicines and assure the quality of pharmaceuticals in the marketplace. Asked about the health project, Dr. Thomas Ejako, the Director of Health of the Ghana Health Services in Kumasi, Ghana, said that due to a robust and unique large number of international medical and scientific partners, Hope Exchange provides a unique specialized formation to the medical community of the whole region. In fact, the Hope Exchange Medical Center will serve as a regional hub for the delivery of much-needed specialized medical training in sub-Saharan Africa. Dr. Benjamin Anderson, Professor of Surgery at the University of Washington, Seattle, and also the Chair and the Director of the Breast Health Global Initiative, comments that Hope Exchange has a tremendous opportunity to create something special in Africa, as its philosophy is give them a fish, feed them for a meal, teach them how to fish, feed them for a lifetime. Dr. Anderson compares what Hope Exchange is doing to what happened in the 90s, when several major international scientific institutions had basically written off Africa for HIV, claiming that it is not possible and neither affordable. But a group of doctors, scientists, nurses and health providers did not buy into this. Today, thanks to this group, the course of HIV has been dramatically changed in Africa. Dr. Lisa Newman, a professor of surgery and director of Breast Care Center at University of Michigan and one of the collaborators of Hope Exchange, says that what Hope Exchange and its partners have embarked on in sub-Saharan Africa might impact the treatment of some of the most aggressive breast cancers in women around the globe. This is because, according to Dr. Newman, such aggressive triple-negative breast cancer is predominantly seen in Afro-American women whose common African ancestry might be the reason why we see this biologically more aggressive form of breast cancer. In 2011, as part of the Hope Exchange ongoing effort to combat the devastating impact of malaria on populations in sub-Saharan Africa, ExxonMobil partnered with Hope Exchange in developing a leading-edge diagnostic laboratory at the Hope Exchange Medical Center. It will also serve as a site for clinical trials of anti-malarial drugs using internationally recognized foremost clinical practices. The chairman and CEO of ExxonMobil, Mr. Rex Tillerson, commented that in Africa, where malaria devastates the lives of millions, ExxonMobil has for years partnered to provide life-saving bed nets, anti-malarial drugs and treatment programs. Suzanne McCarron, president of the ExxonMobil Foundation, said, ExxonMobil is committed to fighting malaria, and with our support, the Hope Exchange Medical Center's new diagnostic laboratory will make life-saving treatments more accessible and readily available. The Hope Exchange Medical Center enjoys broad support from African and internationally recognized academic, medical, and scientific institutions. An example of the premier list of organizations aligned with the Hope Exchange is not limited to but include the prestigious institutions Ghana Health Service and the Ghana College of Physicians and Surgeons. On the forefront of this initiative are several American institutions such as Yale University, Fred Hutchinson Cancer Research Center, and the University of Washington Medical Center, Seattle, the Breast Health Global Initiative, as well as Susan G. Komen for the Cure and Operation Smile. From the other side of the continent, this project enjoys the support of several prestigious European, medical and scientific institutions, such as the Medical University of Innsbruck, Austria, the Catholic Medical University of Rome, and the Royal College of Ophthalmologists, London. Despite the many challenges we face, a unique opportunity exists to help millions of people living in poverty to hope for a better future. Together, we can make the world a healthier place, one person at a time.